Dr. Mike Hine, the Associate Chief of Medicine at the Grand Island, Nebraska VA Medical Center, kicked us off one morning, as Rhonda did this morning. And in his remarks that day, he said to the group, what we should focus on is the fact that the VA provides the highest level of health care in the entire world. We have the best equipment, the best procedures, and the best people. And then he went on to say, it mystifies me that we have such trouble getting along with one another, and we always seem to focus on that. How many of you in this room can relate to what Dr. Hine is talking about? I think we all can, at some level. It's a question of focus. How does our focus get that fuzzy? How do we get that far off the mark? That's what we're going to be about today. As part of the process of building this program, our team talked to hundreds of VA employees throughout the country. That's one of the advantages of an organization like ours that's so spread out. I'm from St. Louis. Rob is a New Jersey, New York guy. Mark is from New York. Jackie's from various places along the East Coast. Just had to check with her about what day it is. Scott splits his time between New York and London. We have people in Atlanta. We're all over the place. So we had the opportunity to go to VA medical centers around the system and talk to employees and find out their view on what the issues and challenges were. And what we found consistently was that the VA can only be organizationally efficient and effective, and we're going to talk about the difference between those two things in just a minute. But that can only happen when there is a continuous and positive interaction across three groups of people. They're listed on the screen. Number one, to start with, is the veteran and that family member. We always start with the veteran. Vets are always number one. It's who we are. It's what we do. If there is not a continuous and positive interaction involving vets, what happens? If the vets think that we're not listening to them, what happens? What's the result? I'm sorry? They get frustrated. What else? I'm sorry? They get dissatisfied. Right? Maybe they stop coming. Maybe they file complaints. Maybe they, act out. Who knows? What if they think we're not talking to them? Right? Bad enough we don't listen. Sometimes we don't talk to them enough. Same thing, right? Yeah. If that interaction is not there continuously, positively, we've got problems. Now let's skip to number 3. Let's talk about leadership. We're talking about leadership at the facility level, at the network level, at the system level. If leadership is not listening to staff and to veterans, what do you suppose is the quality of the decisions that will be made? This is the part where you say something. I'm sorry? Poor? Yeah. How can you make good decisions if you're not considering input from the people who receive the service and the people who actually provide the service? Can't make a good decision. What about the other side? It's a two-way street. If leadership is not talking to veterans and is not talking, how well do you suppose their decisions are going to be implemented? It can't happen. I'm going to go back to my mental health folks back here. Is it not some form of insanity to want a decision implemented and not tell anybody about it? I'm not a clinician. Don't hold me down there. But is it not just a little cuckoo to do that? I realize that's not a term that we like to use.
It's not in the manual.
It's not in the manual. There's an appendix on cuckoo that's going to be published later this year, I think. But the point is this: if you make a decision and you want somebody else to carry it out, doesn't it make sense that you would talk to them about it? Or well, if that's not happening, and the VA, we were told by our design team, sometimes is not very good at handling disappointment and failed expectations, and that probably starts at the top. Okay? Well, you're setting yourself up for that if you're not communicating. Now, let's go to number 2. Why is this number 2, and why is it in bold? Who is it? Who is number 2? You guys. Okay? Why is it in bold and why is it number 2? Look where it is. Right in the middle. All right? That's where you folks are. You are standing right in between two apparently conflicting groups of people. You've got, on the one hand, that veteran and their family members who are caring for them coming at you constantly with their needs and their wants and their aches and their pains and their frustrations and their fears and their anxieties and all of that, and they want answers now, don't they? At the very same time, from the opposite direction, you have leadership at every level in the organization coming at you constantly with their rules and their regulations and their policies and their procedures and their forms and their paperwork and their bureaucracy, and they want answers. And they want them now. Am I right? And here you are, smack in the middle. You got to walk out of this place a lot of days feeling like the rope in a tug of war. Pressure is where you people live. And when that pressure gets that high, it sometimes causes us to lose sight of this number one truth. I get very hard on it. I think Rhonda has had to replace 3 of these since we started. But it's very frustrating to me to see the effect of this kind of pressure on you folks day after day after day when you're the best in the world at what you do. Yes, ma'am?
So are the members of number 3 going to come to this?
That is a fair question, okay? And it's one that I'm happy to answer for you. This program, when it was rolled out, 2 of the first sessions we did were for managers and administrators at medical centers. And one of the early programs we did, there was an individual who was the network director of Network 23 when this program was developed, Dr. Randy Petzel, who is now the Undersecretary of the VA for Health. Right? Dr. Petzel came to the program himself, and when it was over, he told the assembled group, "This is the most powerful training I have seen in 20 years at the VA." And then he asked us to come and present the program to all of his direct reports. And he told those people, "I want this program available to every employee in the VA in this network as soon as possible." So we do have, this program does have the support and participation. Your director here, Mr. Hill, has been with us a number of times when we've done this. He has kicked us off whenever he's available to do that. This program does have the understanding and support of senior leadership at all levels. Okay? A lot of times we'll have a good mix of supervisors and non-supervisors in a particular session. We don't happen to have that today. But we have done sessions that were strictly supervisors. Okay? And we have an offshoot of this program that is geared toward supervisors and union representatives to help them guide this process. So your question is fair, and the answer is yes. Leadership is involved in this initiative. Okay, thank you for asking that. Okay? Now, when we lose sight of this, it's not, and one of the things I have to point out early on, we're not here to bash anybody. Okay? One of the things I'll keep coming back to is that all the people we're going to see and hear and discuss today, these are all good people who are trying to do what's best for the veteran. The problem is this. They get caught in a gap between what's supposed to happen in a situation and what actually does happen. When that gap gets wide, who falls into it? You do. The veteran does. What we're about today is finding out why that gap is there and doing what we can to narrow it. Right? So, when we say that the pressure causes you to lose focus on this, where does that focus go? Well, let's go back to the concepts of efficiency and effectiveness. If you're going to have quality in anything, I don't care whether it's building cars, making pot roast, whatever it is, you've got to have a balance between efficiency and effectiveness. Efficiency can be thought of as doing things right. Effectiveness can be thought of as doing the right thing. Now, here's where the problem comes in. It's not that nobody ignores totally either one of those things. It's a question of priorities. As staff people, as folks who deliver the services to vets, your principal focus 99% of the times is on effectiveness, doing the right thing for that vet. Leadership focuses a lot on efficiency, doing things right. How does that cause problems? These are both elements of quality. Well, here's how the priorities can cause difficulty. There was a lady in central Iowa, she's a nurse. She's working in her office one day. She said to her supervisor, I'm going to step down to the ladies' room and be right back. On her way down the hall, she spotted a veteran seated in a chair along the wall. The individual was obviously upset. Just catatonic almost, paralyzed as it were. So she stopped and asked him what the problem was. She learned that he had just received a terminal diagnosis from his provider, that he only had X number of months to live. He had no family members with him. He was so devastated, he couldn't even muster the wherewithal to navigate his way out of the facility to get on the shuttle to go home. He was completely destroyed. She sat down with him, she talked to him, listened to him, worked with him, and finally got him composed enough that he could at least get home. Took her 45 minutes. Got back to the office, supervisor said, "Where have you been? Thought you were going to the ladies' room." So she told her the whole story. Supervisor said, "Okay, that's fine. Just make sure you get your paperwork done by noon." Okay? The supervisor was not uncaring about the veteran. All right? But it was a priority thing. And that sometimes causes the pressure and the friction. That there is an emphasis on efficiency here, on effectiveness here. And it's when we don't reconcile those two things and realize that the balance has to exist, that's when the problems occur. And that's what we're going to be about today, is trying to find that balance and restore that balance. Now, how are we going to do that? Well, everything we do in the course of a day is focused on communication. If we are going to resolve confrontations, if we are going to manage conflicting points of view, if we're going to help work through these stressful situations to a better outcome, we need to focus, at least briefly, on who we are and how we communicate. Because that's going to be the solution right there. Now, there are different ways we can approach communication. And if we were to talk about it, we would probably, most of us, consider ourselves to be cool responders. That in any situation, we would take a minimized kind of approach and smooth over the concerns of others and react to a situation in a cool, calm, collected